Augmentative and alternative communication versus spelled communication. Oh good, another thing that the autism world can argue about. Except this time, it seems to be the professionals telling you what's best for your child yet again. Professionals who, last I checked, do not live in your house, do not know your child, and most of them actually don't fully understand autism and the motor planning issues that come along with that. Yet somehow they still have the audacity to make you feel like you're doing it all wrong. So today, I'm going to break down one of the biggest criticisms of spelled communication. I'm going to compare it side by side with AAC, and I promise you, the similarities are going to make some people very uncomfortable, mostly the ones with all the credentials. But that's okay, because I want you as the parent to be an informed consumer and make the decision on what's best for your child, not the professionals or others on social media. So let's dive in. For those of you who are new here, hi, I'm Dr. Dana Johnson. I'm an occupational therapist with a PhD in child mental health and development. And I help parents of complex autistic children understand what's really driving their child's challenges. So let's start off with a brief overview of what AAC, or augmentative and alternative communication, and spelled communication are. So first, AAC is typically taught by a speech-language pathologist following a formal assessment. And this assessment typically begins by evaluating the individual's motor skills, cognitive level, vision, and communication needs, and then they will match them with the most appropriate system. And you might be familiar with some of these options. The first one is the Picture Exchange Communication System, or PECS. It might be sign language or a speech generating device like an iPad with icons that you push and then it speaks for you. Now, a key teaching strategy is what's called aided language stimulation, or ALS. And this is where the speech therapist or communication partners combine their own speech with pointing at picture symbols. So they're modeling these things. They model this AAC use. They illustrate to the child or the individuals that this system is useful. And they're demonstrating that it's a great way to be able to communicate. And this happens over all environments, like the home, school, playground, wherever the child frequents. And it often involves the whole team, including the family, teachers, and therapists. Now, spelling is initially taught by a certified provider, and there are three main methods: rapid prompting method, spelling to communicate, and speller's method. Now, full disclosure, I am the co-creator of Speller's Method, and I own Speller's Center Tampa and Speller's Center Atlanta. I'm also an occupational therapist and expert in whole body apraxia and autism. Now, just to be clear, I'm speaking solely about Speller's Method for the rest of this video, and not about RPM because I was not trained in RPM. I was initially trained in spelling to communicate, or S2C, and each method is different, and that's really important to know. So for Speller's Method, we teach the motor skills first because all communication, no matter what form, requires intentional motor planning. So whether I'm texting, whether I'm speaking, whether I'm pushing, whether I'm kicking, it doesn't matter, making a face at somebody, that's communication, that all requires intentional motor planning. So the teaching itself, or the practicing of the spelling method, is motor focus. So we practice and focus on the motor skills, and once we build those motor skills, then we can start to ask more high-level cognitive questions. And with Speller's Method, we have a very, very specific process. It isn't just about jumping that letterboard in front of somebody. So these are important, and I will put way more information and research on each of these methods in the description below. Okay, let's get to the comparison. So first, who teaches it? Well, AAC is designed and overseen by a licensed speech language pathologist, and they're often, working with a full team that includes teachers, OTs, and families. Now, spelling is taught by licensed providers who have been highly trained in one of the three methods. And then the providers will train communication partners, which may or may not be parents, to work with the students to, again, practice the motor skills first before we can ask those open-ended or higher level questions. So secondly, the theory of the problem. AAC treats communication difficulties as a mix of cognitive, linguistic, and motor factors that vary depending on the child. Now, spelling treats the problem as purely motor, that the language is already there, fully intact, but the body just needs to build the reliable motor skills to access it. Now, are there non-speaking children who may be cognitively delayed and therefore spelling may not be the right option for them? Of course that's the case. But I want to make sure that I'm teaching the motor skills first before I'm testing as to whether or not they have a cognitive disability, because we have to presume competence in every single individual. And presuming competence is that they want to learn and they have the ability to learn, especially because these individuals cannot reliably show us what they actually know. So let's presume competence, let's teach them the motor skills, and then we can assess whether or not they actually have a cognitive disability. Okay, so where does all this process start, right? So AAC meets the child at their current developmental level, not necessarily at an age-appropriate level. So you don't need to know the alphabet to start. Often the therapist doesn't believe they know the alphabet because they can't reliably demonstrate that they can identify all 26 letters. They use prompting, so AAC specialists or SLPs use prompting to teach the child the cause and effect of the AAC use. So you ask for juice, then immediately they get juice. And then this is what's practiced over and over and over again. And then we move on to a different button, or we progress from there. With spelling, we teach the motor skills first before asking any comprehension questions. And we use prompting to do that. Similarly, you would, if you were hiring a golf pro or a tennis pro, you would expect them to give you prompts. You would expect them to give you feedback because you've never done this before. That's what we have to think of when you're thinking about the providers, is that we're essentially your child's coach, and we're your coach because we're going to coach you too. So once the motor skills are developed, influencing prompts are completely eliminated, and they have to be for that open-ended communication. Okay, independence. Now, with AAC, the explicit goal is independent communication. A child who can use their device with any partner in any setting. Now, I'm going to come back to this because I have some thoughts specifically about this. And for spelling, it requires a communication partner to be present at all times. I'm going to talk about why this is as well. Independence on a keyboard, though, is a long-term goal with spelling, but it requires a communication partner throughout the whole process. Now, the evidence. This is also a point of contention among those who are discussing AAC versus spelled communication. Now, AAC has decades of peer-reviewed research, multiple systematic reviews, and randomized controlled trials behind it. Now, I have a few more questions about this that I will get to in a second. And it's also been endorsed by ASHA and the AAP and major autism research organizations. Now, spelling has a growing but not yet rigorously controlled evidence base, although it's happening, and has received many cautionary statements from the same professional bodies that I talked about earlier. But here's the thing. Absence of evidence isn't evidence of absence, meaning just because there aren't any randomized controlled trial studies doesn't mean that it's not real. And if you're a parent or you're a communication partner that is spelling with your child or another speller, that's enough evidence for you. So what is the biggest criticism of spelled communication? Well, I'm going to get to that. But first, I want to talk to you about my biggest pet peeve of all time with this. And that is that all three of these methods, they put under the term facilitated communication. And facilitated communication or supported typing is when the facilitator will then touch or hold the arm or hand of the individual who is spelling or typing. Now, as I mentioned, I'm only going to talk about Speller's method, and I will tell you that that is not true for Speller's method. Speller's method, we do not physically touch the speller when they are openly communicating. Now, just like AAC, when they're learning the movement, when we're practicing the skill during the acquisition phase, we do sometimes help the new speller to learn the motor plan. But then we completely eliminate every single influencing prompt. That includes touching. We do not touch. I just want to make that clear because that's a little pet peeve. Okay, so the biggest criticism of spelled communication is that you need to have the communication partner hold the letterboard or keyboard for the individual to communicate. Now, that is accurate, and I'm going to give you specific reasons why this is necessary. Okay, reason number one is vision. As I've said in previous videos, the majority of the clients that I have worked with have vision challenges. So the letterboard and keyboard held upright while learning the motor plans, especially during that phase, will support their vision better than when it is flat. And so they need that support because their own body struggles with those vision challenges. Most of these challenges go undiagnosed as well. Number two is co-regulation. We know there is ample research that's out there on autism and those with autism and how they process sensory information differently. They do not have a filter like we do to process the information coming in. And so therefore, part of my job as a provider and their communication partners is to help them to stay centered and stay present in that moment and not have their brain attending to other things. And secondly, they have whole body apraxia. So when the sensory information is just too much, just like us, our intentional motor skills are not going to be on par. They are not going to be good. They need somebody to co-regulate with them because of how their body responds to the environment around them. And then prompting. The prompting is there to teach the motor skills first as we're going through the acquisition phase. And then specifically with Speller's method, when we're talking about those higher levels, like asking comprehension questions or why questions or how questions or what is your opinion on, I cannot influence them. And all of those prompts are eliminated, or I just don't ask those questions. Now, speaking of influencing, can it happen? Does it happen? Wait, don't we influence each other all the time in our conversations? All answers to those questions is yes, of course. And unfortunately, I am not going to deny that there are horrible stories out there where someone has influenced the person by moving the board or their hand and just having power over them. It's horrific. So I'm not going to deny that there aren't people out there and that this didn't happen. We are in a very powerful position, and that position has to be respected. I am not making any excuse for any of that. AAC and spelled communication are actually more similar than people criticizing spelling probably want to admit. Both require a trained provider. Both require a communication partner at some point in the process. Both are subject to influence. Both involve motor learning. And both are working to the same goal, giving your child a voice. Now, the difference is in the theory of the problem. AAC assumes that language needs to be built. Spelling assumes the language is already there and the body just needs it to learn how to access it. Well, neither approach is perfect and neither has all the answers. And guess what? There will always be criticism of every single approach in whatever therapy you are considering. But you, as the parent, deserve to know that both AAC and spelling exist. And guess what? In my world too, they can exist together. I have clients that use both, and that you get to decide what is right for your child. Not a professional, not a committee, and not a comment section, or even another parent. If this video gave you something to think about, please share it with another parent who's in the middle of this decision, maybe right now, because nobody should be making it without the full picture. And if you want to go deeper, I've linked more information about Speller's method below. Come find me. I want to hear your questions, your stories, and yes, even the pushback. Please, I welcome conversation. You don't have to agree with me on this. It's exactly how we have to move forward. Let's talk about it. Autism parenting is not perfect. My goal is to empower you to make the best decisions for your child. Be sure to check out my earlier videos on all topics related to complex autism. You've got this. Thank you, and I will see you on the next video.